Hello and welcome back to On the Couch with Nikki, where I bring you experts for expats. Thank you to Expat Dental for sponsoring this episode. They make smiling easy. So who's on the couch with me today? I have Tim Cushway, CEO of Iron Suites Medical Centre, and Dr. Cheryl Kam from Mint Medical Centre to talk about iron deficiency. Did you know that 1 in 3 women is iron deficient? Let's find out why. Dr. Kam, 1 in 3 women is iron deficient. That's a staggering statistic. So how would I know if I'm iron deficient? How does one know?
So for a regular person, and even for the pregnant actually, it's a very, very slow decrease in your energy. You know, there are many reasons that we give ourselves. We say that we haven't had enough sleep.
Yeah, there's lots of reasons that you can be sluggish or tired.
That's right. When your energy is depleted, you'll find that you get irritated a bit easier. And so anxiety and depression are quite common.
Okay.
Presentations of iron deficiency. A lot of people that come in to me with mood disorders, iron is one of the first things I check to ensure that it's not correctable before thinking about other causes of depression and anxiety.
And if it's 1 in 3 women, then chances are you probably do need some treatment to stock up on some iron. So what is the treatment?
The most conventional treatment is taking a supplement. It needs to be taken for at least 6 months to a year before we can track progress in iron.
Wow.
We're lucky now that in Singapore we've got a dedicated IV iron suites, and that's changed the lives of a lot of my patients.
Dedicated iron suites.
We're focusing on providing intravenous iron infusions.
Ah.
So rather than a year of tablets, we offer basically 1 injection to fill up the iron stores in the body.
1 and that's it?
For most patients, about 80 to 85% of our patients, 1 injection is enough.
Wow. So financially, how does it compare to the 1 hit versus 12 months of?
To be honest, it's very similar in overall pricing, especially if you factor in about 50% of the cases or 50% of women who take oral iron don't have any effect from that oral iron, so it's purely wasted money. But
even after 12 months, it just doesn't do
12
anything.
months.
But even for convenience, why wouldn't somebody just go for the hit of iron and then you're done?
But this is the perfect solution for those who can't tolerate or don't absorb oral iron.
More people are taking an oral supplement than getting the intravenous treatment.
Yeah.
Where's the disconnect?
And Singapore, I think it's still a growing area. And to be honest, for most of Asia, that's the case. In Australia, in the last 5 years, it's rapidly increased from around 5,000 to about 50,000 per month.
Okay, but it's the GPs that people go to, and then it's you that refer people to the treatment. So is it the GPs not being aware of it or not choosing to direct people there?
Things are changing right now, and so traditionally people would be testing, and doctors would be testing the iron levels, but really what we need to be looking at is ferritin levels, and much more research has come through helping us to diagnose iron deficiency using the ferritin levels. 30 for me is a magic number, so if your ferritin is less than 30, definitely you need to be getting an iron infusion. In the past, we only really used to worry about iron deficiency when a person became anemic, so when your blood cells go low and you turn pale. But we're beginning to find that in those pre-anemic stages, you're already having symptoms, and people are speaking up about their symptoms a bit better. And you know, when we take them to heart and go test, then we realize their iron stores are low. Now, by treating the iron stores even before the anemia has set in, you avoid the need for a blood transfusion. You avoid a lot of chronic diseases.
Somebody's iron deficient, they have their shot of intravenous iron. What will they notice, and how long will it take to notice?
So, excellent question. About 2 to 5 days later,
Ooh, so
most
soon.
of our patients say they feel much better. If we have the gym junkies, they really get a big boost on the number of burpees they can do or number of push-ups.
Yes, I probably would.
Many ladies have come back and said that they really feel that their sex life has come back. We've had ladies who have said that and maybe it's also around the depression, that this has given them a new lease on life. And
it's
all
the
parts of
mood
their
and
life.
the energy. So your energy levels return and you basically feel a little bit more yourself again.
Wow, so this could really help relationships.
Yeah, and then over time, your hair quality, your skin quality gets better, your attention, your focus gets better. Some people have come back to me and say they're sleeping better.
So there's a lot to be gained. Could somebody who's not iron deficient just choose to do it just for all those reasons?
Well, there are some people who are slightly iron deficient, and perhaps we can consider a treatment because this treatment really is quite safe.
What surprising things have you noticed from people who have had the treatment?
Here's one lady who had mouth ulcers and they disappeared within days. We've had a couple of ladies now who have been keen to fall pregnant for many years, have been trying, and whether it's coincidental or not, had iron and come back a few weeks or months later. Well,
Pregnant.
Low iron is associated with not ovulating. So you might have your period, but you're not releasing an egg if you're low in iron. So this is a very interesting point.
How long does the treatment last?
They may never need a second dose and it will last for life.
Okay. Should you get retested anyhow or just wait to see if you're experiencing the symptoms again?
It's an interesting question. Many patients, if they need a second dose, after they've had the first, they feel the benefit.
They
They'll
probably want it
notice-
anyway.
Well, they'll notice when their levels get low and they start
Yeah.
to feel those very, very early symptoms that before you put down to Monday morning or to just general life.
Yeah, they'll be booking in again.
Yeah. So I think it's probably worth checking it every other year or every year as part of it. Unfortunately, ferritin at the moment isn't part of most health screens, so you'll probably need to ask the GP for
Wow.
checking ferritin or
Okay.
doing a health screen asking for ferritin.
We need to
Or
put
going see
ferritin
Dr.
on the
Kam.
map. If somebody comes to the iron suites, can they just get a shot of iron or do they need a referral?
Most of our patients come from referrals like Dr. Kam.
Okay.
So the doctor has done the workup and sends the patients to us along with all of their labs, and those patients will just go straight for infusion, and occasionally we'll have the patients who walk in and say all of the symptoms you've described, our doctor will see them, run the same set of lab panels. If iron deficient, proceed to manage the iron deficiency, plus find out what caused the iron deficiency.
How long does the procedure take?
So in our clinic, we book the patients in. It's a 1 hour duration.
That's a lunch break.
It's a perfect lunch break.
1 in 3 women is iron deficient. So you need to take control of your own wellness journey and get your iron checked. Get your ferritin checked. And when you get the results, look at the number. If it's below 30, then ask your GP for treatment. Or go straight to the iron suites and get them to advise you so that you can live your maximum quality of life. Thanks everybody, I'll see you next time.